Good morning, Southeast Missouri, and wherever you may be listening. This is the Retirement Playbook brought to you by Innovative Financial Solutions. I hope everyone's having a great Saturday morning. I'm also joined by my co host, Mr. Tony Shore. Good morning, Tony.
Good morning, Brock Allspa. Great to be here. And for our viewers, our YouTube viewers, no, I'm not sunburnt. I know I kind of look like a lobster. It's the bad lighting. We're going to fix that. But yeah, I was looking at my video
You
there and I'm
do
like,
look like someone that forgot to wear their sunscreen on Saturday.
yeah, actually, I was outside working a bit. So I guess some of it's actually sun. But yeah, I was doing some work outside, but it was so cool. I can't imagine getting sunburned when it's that cold out. But hey, it can
You
happen.
never know. Well,
It can
listen,
happen.
hey, I'm really excited about today's show. A lot of relevant information, timely information that we're going to give the folks here today on
Good.
the Retirement Playbook. And so excited to do that. But before we do, folks, I want you to go to our website. Okay. There's a lot of great information on our website. It's theinnovativeteam.com. Theinnovativeteam.com. You can check out past shows. You can download our Roth conversion guide. You can order my book. It's called The Last Paycheck: How to Build Sustainable Retirement Income and keep those paychecks coming in just like when you were working. You can do that if you get a plan and you start the there's never a better time than now, right, Tony?
Yep.
And so getting started earlier the better. And even if you're 5 to 10 years away from retirement and you think, I think I'm okay, but I'm not sure, why don't you just get an answer and be confident about what you're doing? You can do that by giving us a call here at Innovative Financial Solutions, 573 332 7855. Or you can, again, look us up on the web at theinnovativeteam.com.
All right. Great start to the retirement playbook today, Brock. And you're looking good, feeling good today. I know you've had a busy week, though. We're
For
talking
sure.
about Medicare today. I
Yeah.
think it's really important because we are basically headed into open enrollment here, right?
You got it, buddy. This week, October 15th, is coming up, and that's going to be the open enrollment period for Medicare folks. So I want to hit on a few topics with this today and kind of give some people some general information to, again, use in your life. That's what the purpose of this show is to
Right.
give you information that can help you enjoy and get through into retirement. And so this is a very good topic because if you're 65 years old, you're probably wondering, well, how do I do this? Or older, because every year you can change some certain things during this open enrollment. Okay. So,
Right.
open enrollment starts October 15th. It continues through December 7th, Tony. And it gives you opportunities to change some of the things, your drug prescription plan. Maybe you've realized, well, I'm on this particular drug and when I signed up, but now I'm on a different one and it's not in the formula. There's many reasons why you might change prescription plans, but this is the time to do it.
Yes.
Okay. And so open enrollment, what can you change during this time? You can switch from original Medicare and Medicare Advantage plans. Okay. So original Medicare, what you would typically see, Tony, is someone would have Part A and you would have Part B. And we'll explain these both here in a few minutes.
Sure.
And then you would have that would cover 80% of your medical bills in retirement. So what do you do about the other 20%? Well, a lot of people and what some people do is you buy a supplement, okay, or what they used to call Medigap policy to cover the other 20%. Okay. And so when you're looking at all of this and adding it all up, you go, well, this is kind of expensive because you got to buy a drug plan too. And so some people have explored the opportunity to go into a Medicare Advantage plan. Okay. And again, this is what you can change. You can go into an Advantage plan from this time period of October 15th through December 7th. Okay.
Yeah. Yeah, and that's important. And I think we're pulling these facts have been gathered by a great website called MedicareResources.org. If our
Right.
listeners want to check that out, again, the information we're bringing to you today, Brock. I know you work with your clients to help them with Medicare planning. But the information can be found on MedicareResources.org. So, open enrollment, which is also known as the annual election period, right?
Right, correct. And so it allows you to, again, switch from original Medicare to an Advantage plan, or maybe you realize, okay, I'm with this particular company using this Advantage plan, and you realize, well, you know what? There's another Advantage plan that might be a little bit better, might be a little bit cheaper, might provide some extra benefits that you need and would like to have. You can change your Medicare Advantage plan now to a different company or a different type of Advantage plan. So that's what it also allows you to do during this time frame. One other thing that you can do is change your prescription plan, your Part D plan. You can, again, you realize maybe the one you were in isn't quite exactly right for you. So you decide, okay, I want to switch to a different Medicare Part D, or what we call a prescription plan. And again, a lot of that is, and by the way, we're referencing this website. Medicare.gov is another great website. The federal
Yep.
government has that website, and they will give you lots of different information as well. And you can actually, Tony, type in what your prescriptions are. You can type in your zip code, and it will spit out some plans that are probably a good thing for you to look at, right? So that's
Right.
really helpful as well. But
Well,
when
they
it
and
really,
they constant and they sorry to interrupt, but they
that's okay.
constantly make changes to these Advantage plans, and they've gotten better and better over the years. So it is really important if our listeners are like, "Well, I like my plan; it works for me." You really should review it annually during this time and meet with somebody who knows about this and can look at where you're at, because they might look at it and say, "Well, we could save you X amount per month." Or the cover, you could get better coverage for the same amount. Sometimes those things happen, and you really want to make sure you're maximizing that coverage and minimizing the cost. Isn't that the whole point?
It is, and it's not just the cost. I mean, that's obviously a big part of it, but it's really the right plan, right? In other
Right,
words, does it meet your needs? Some
right,
plans offer X benefits. I mean, it's a silver sneakers type thing where you can get some gym memberships for free. It's really it's just like everything else, Tony. When it comes to financial planning, it's so customized. Um, so one of the things that we look at when you're talking about the cost of your healthcare and retirement, because that's a big one, right, Tony? I mean, everybody wants to know, okay, what is it going to cost? So let's
right.
kind of visit that
Okay.
right now. And when you're talking about what it's going to cost you in retirement for your healthcare, a lot of people go, well, I'm really hoping that it's all taken care of through Medicare because I'm 65 now. And that's not quite the case. Okay.
No.
Now, it can be cheaper than when you were, say, working on your group medical plan.
Hmm.
Or maybe you had your own plan that you purchased, through the exchange, or maybe some private insurance that you had. Um, one of the things that you have to look at is your overall cost. It's not just about your monthly premium.
Right.
It's about um
Your out of
the
pocket costs, your overall out of
exactly.
pocket costs is what you're
Exactly.
saying,
Thank you.
right?
Yes,
Yeah.
that is correct. So when you're talking about the overall cost of your plan, you've got to consider Medicare, right? The cost for your Part B. Okay. So let's just talk round numbers here. $150 a month per person. Now, this is per person. So if you're married, you've got to double this. Around $150 a month. You've got if you go with the traditional route of just getting a supplement or a Medigap policy, you're talking I mean, depending, you have different plans. And by the way, you need to shop that too. Okay.
Oh,
Your
yeah.
supplement, because the great thing about those is the government has said, all right, companies, you can offer different plans, but the difference is going to be you have to cover all of these medical expenses. So in other words, Mutual of Omaha or whoever the company is, if you have a plan G with this company and you go to a different company, but you stay with plan G, they have to cover those costs. Okay. So the only difference is what? The monthly premium.
Right.
Okay.
Right.
And so if you're looking at,
And
oh, hey,
hopefully the additional coverage of things Medicare doesn't cover. That's the whole point. Like,
that's the whole point.
hearing, vision, dental, maybe even some long-term care. These are things that Medicare will not cover. And you need to look at supplemental or advantage plans then, right?
Exactly. And so when you're looking at it, the advantage plans, obviously the reason why people go with those is because they are typically cheaper on a premium basis, Tony. Again, kind of really want to stress that because people go, "Oh my gosh, it's $13 a month and it's going to replace my Part B and I don't have to pay that and I don't have to pay the supplement." Be careful. Okay? I'm
Yeah.
not saying it's not right for you, but be careful. Okay? Make
Because
sure
what you have
that
to look at is that bottom line, those out-of-pocket costs
but
total, right?
correct, but not only that, Tony, but you're looking at things like, hey, if you travel a lot, okay, some of the advantage plans are pretty specific on who you can go see from a physician standpoint. So you've got to make sure that if you're traveling and if you're traveling out of the country, that you have the right plan because that advantage plan may not cover you when you are traveling abroad. Okay.
Wow.
And
Okay.
yep, exactly. And your Medicap or your, supplement typically does. So again, it's not all about the money, folks. Let's get the right
Right.
plan for you. I wanted to clarify something. I just looked this up, Tony. 174.80 is going to be the premium in 2024. For
Okay.
2023, it's been 164.90. I said around 150, but I just wanted to clarify that. Okay.
Yeah, it goes up a little bit each year,
Right. So 174
typically.
for your Part B. So let's go back to our, talking about the actual cost of this. 174 for your Part B. You've got a typical premium for your supplements going to be around that same price. It's going to be around 175. So now we're up to 350 again per person. But that doesn't cover everything, right? You have your prescriptions. You're going to look at about another $50 a month. So it's about $400 again, give or take, to have coverage, medical coverage in retirement. Now per person. So that's $800 a month for a married couple.
Right.
My point to bringing this up, Tony, is that part of your retirement budget? If it's not, it better be. So to understand what you're paying. Now, the great thing about it, when you're comparing getting on these plans and doing Medicare B and doing the supplement, is that when you are looking at this, again, looking at it from an overall perspective, a lot of this doesn't include any of the big deductibles that you've been used to when you were
Yeah.
working. Okay. So you might have a deductible with whatever plan you go with on the supplement, but it's not anything compared to the thousands of dollars you've been used to in deductibles while you were working or before you became eligible for Medicare. Okay. So it can be kind of confusing. It is you need to have a plan, not just, oh, hey, this is what I'm going to do. No, why are you doing it? And how can you help yourself maybe save a few bucks or more importantly, have the right type of coverage and right plans? So, Jason Lee in our office at Innovative Financial Solutions specializes in this, and he can help get this done for you and consult you on what plans are out there and what, more importantly, will be best for you. Okay.
Right.
So, when you're talking about all the different dates and you're talking about the annual enrollment periods, that we're now coming up against, it's important. But also, just a quick note too. Let's say you are in an advantage plan, Tony, and you decide I want to either stay with it or maybe change to a different advantage plan. And then you realize maybe this is your first year of doing it, and you do it in October, let's say 20th. All right. You decide a month later, oof, this isn't right for me. That's not what I thought it was. Excuse me. You can change that and go back to what you had as long as it's done before the deadline of December 7th. So you do have some flexibility there. You can change your mind, pick a different plan, but as long it has to be in that time frame of December 7th. So what I would encourage people to do is if you're thinking about doing something like this, first of all, make sure it's the right decision for you. And if you need help, give us a call. But also do it early, okay? Because if you do it early and you get into it earlier, you can change your mind. But again, it has to be by that December 7th deadline there. Okay.
Okay. So you can change your mind, um, and if you're eligible, then you can make changes during Medicare open enrollment or that annual enrollment period. I
hmm
like that. But can you sign up for Medigap during the annual?
Yeah, so typically what you look at with the Medigap or the supplements, Tony, is that you look at your annual enrollment. So in other words, whenever you enrolled in that supplement, so let's say your birthday is in June, okay, you can sign up 3 months before or 3 months after your birthday and for these supplements, and then on when you do that, that's your anniversary date. That's when you would want to look at the different plans on again the supplements or what you refer to as the Medigap policies. So that's more of a an annual deal when your anniversary comes up as far as
Sure,
changing your supplements. Really, this period here, we're talking about looking at or considering and then enrolling in an Advantage plan and your prescription plan. That's these are the big changes we're looking at right now. Okay.
sure, sure.
Um,
And the stats are interesting as far as how many people change their coverage during the annual period, this annual sign up period, right?
yeah, yeah. And one of the things that you need to look at when it comes to changing your plan, again, I can't hammer this home enough, Tony, which is looking at your overall picture, not only the premiums and what
Right.
actual plans are right for you. And by the way, I'm just going to say this. If you can afford a supplement, uh, I lean towards getting the supplement over the Advantage plan. Okay. And I have all my own reasons for that. If you want to discuss that, call me. We'll talk about it. But that's just my that's what I lean towards. That's my advice that I give
Sure.
you. If you can afford to just do the traditional route of paying the Part B, paying for your supplement, paying for your prescription plan, to me, that's the best way to kind of go about it. So at that point, Part B is pretty easy, right? You turn
Yeah.
65, you've already got your Part A, and you enroll in Part B. It's already, they start deducting it from your Social Security. If you haven't elected your Social Security benefits yet, then they'll just deduct it from your checking account. And then, you get your supplement. That's the supplement's really the piece that is pretty easy too, because again, they standardize these plans. So we just go with a company that's reputable and is doing this for a long time and has the lowest premium. And then your prescription plan is just making sure that your drugs that you take are covered within that prescription plan. So it's not rocket science, but it is something that is nice to have some consultation. And again, that's where we come in. Folks, give us a call at 573-332-7855. Okay. And again, ask for Jason Lee, and he can help walk you through the different aspects of doing all of this.
Yeah, yeah, and I think that makes sense, and, but not a lot of people take advantage of the annual election period. Yeah, I mean, the stats from that website say only 10 to 13% of people per year, but it depends, like you say, maybe they don't need the Advantage plan, so they don't need to make a change, but you
Right.
need something. You need supplemental Medigap or an Advantage plan because you're going to need more coverage than just basic Medicare can give you, right? I mean,
Yeah,
most
for
people,
sure. I mean,
but everybody's situation is different, what they
it
have,
is.
what they can spend. And that's why they need to sit down with somebody who can talk to them about it.
But Tony, you know why those stats are that way, right? People just get into a plan, they don't really think about it, they don't really do anything about it. Maybe the only time that really comes up where they go, "Oh my gosh," is because what? The medical bill didn't get paid or didn't get paid based on the amount they thought it would be paid on. And that's when everything really comes to a head, okay? But that's the importance to making sure that you've enrolled in the right plan. And so those things don't happen. You don't have these big surprises. So anyway, yes, that does not surprise me. By the way, that stat there. So okay, Tony, I'd like to shift gears here a little bit, and I want to stay within the medical realm here, but I do want to address something. Okay, locally that's happening right here in Southeast Missouri. So Mercy Medical Group has purchased the hospital in Perryville, Missouri here. Okay. Hopefully that turns out to be a great thing for them and all of the employees and there and everybody continues to service the medical needs of the community. And I'm sure they will. But the reason I bring this up, folks, is because if you do work there, or if you know someone that works there, there's an opportunity that started this last couple days. Okay, for those people to have a once in a lifetime flexibility moment. Okay, what do I mean by that? When you put money into a retirement plan, it's pretty, you're putting it in from your paycheck and it's going into this plan, and that's great. You should be doing that, no question about it. But you really have a lack of flexibility until you turn 59 and a half, or you retire, or if you leave that facility or that job. Okay. Right now, these people have an opportunity to continue to do what they want to do with, Mercy, but they also have the flexibility and opportunity to either roll into the new plan with the 401k with Mercy, or to have that ultimate flexibility to say, hey, I want to roll this money to an IRA to where, it can be a little bit more, there's more options that would be available than just the lineup of the Mercy. And so that opens up the kind of investment world, and it offers allows you to have the opportunity to work with folks like us. Okay. Now, let me clarify something. I'm not saying everyone should do this. I'm not saying everybody should take their balance and roll it to an IRA. Sometimes that's not a good thing. So the important thing is to know the best thing for you to do. And that's all you have to do is give us a call. We can help you make the best decision. Sometimes rolling into the new 401k is the best option. Sometimes rolling it to an IRA is the best option. And unfortunately, there is another option, is to cash out. Don't do that, folks. That's the worst thing in the world you could do. Paying taxes, paying penalties, doing all this stuff, and then not having any savings for your retirement, which was the purpose in the first place.
Right. I mean, there are always extenuating circumstances for a very few people, and that is why we constantly say, set up that no charge, no obligation consultation. The only thing it's going to cost you is a little bit of time. And I know that you're more than happy to talk with our listeners and viewers out there about their situation, because you want to do what's in their best interests. But in order to do that, you've got to see where they're at, what their needs are, and then say, okay, if for that 401k, you want to do this. It's in your best interest. Let's do the math and see which is in your best interest. But like you say, almost never is it to cash out, because usually you get less money that way, unless you've got a terminal illness or flat broke and you can't live without it. I mean, there are extenuating circumstances, I'm sure, for a very small percentage, but you gotta be smart about it, right?
Look, we're a fiduciary for a reason, Tony. That's the bottom line. Is we have an obligation to do and give advice based on what is the best thing for the client. Okay. That's what a fiduciary means. And that's what we've been. Okay. In our business, that's why we've built a good business. It's because we do the right thing. And we do act as a fiduciary. So my point is absolutely 100%. So, but again, we can't just give you and tell you exactly what to do and what option is best for you. Give us a call. We'll walk through the process. We'll walk through the options, and we'll say, hey, the best thing for you to do probably is just go ahead and get a financial plan, get a retirement income plan, so you can project these things out and understand what your options are. And so anyway, give us a call, folks. It's real simple. 573-332-7855, or look us up on the web at theinnovativeteam.com.
All right. Thanks, Brock. And that does it for today's episode of the Retirement Playbook with our host, Brock Allspaw.